Hello, my name is Farhad Hafezi from the ELSA Institute in Zurich, Switzerland. The topic of this interview is therapeutic refractive laser surgery for keratoconus. Keratoconus patients have been a very interesting addition for a refractive laser surgeon in the past years. It is a subgroup of patients we were not able to do anything about the surface until very recently, until 5 or 6 years ago, simply because of the altered biomechanics and the further deterioration of biomechanics whenever a surgeon would touch such a cornea with an Excimer laser. But with the upcoming of cross-linking technology, we have found a means to strengthen such a cornea, and then we can, in a second step, perform therapeutic refractive laser surgery, which in most cases is wavefront-guided PRK, to improve the useful vision of the patient. And this is exactly the difference to a standard cosmetic case that wants to get rid of his glasses. If we have an irregular cornea, like in keratoconus, it is much more about improving the quality of the image and improving the best spectral corrected visual acuity, distance visual acuity. So if I see a young woman, for example, that comes to me with a cone at the age of 25 or 6, I personally first perform a cross-linking in order to stabilize the cone if the cone was progressive. Then I'll wait 6 to 12 months and reassess the situation, knowing that some of the patients still show flattening of the cornea, knowing that in rare cases 2 to 3% even an epi of cross-linking would not yet stabilize the cornea. So I would take care of stabilization first. Once this cornea is stable, I will be facing an irregular astigmatism and a low CDVA of maybe 2040, 2050, 2063. And I will discuss with the patient that my aim as a surgeon is to improve the useful vision with glasses. This patient might be wearing contact lenses in daily life, but we all know that she will not be able to wear contact lenses throughout her entire life without any issues. So the more often she can switch between contact lenses and glasses, the better. So my aim is to give her better vision with glasses. So all I promise her is trying to regularize the cornea and trying to gain 1 line, 2 lines, maybe 3 lines of useful vision. And once I am perfectly clear with this and have the confidence that the patient has understood these target values, then I proceed. And to do so in a cross-linked patient, we still had an issue until 2 years ago. Does an Excimer laser ablate the same amount of tissue in a previously cross-linked cornea? In other words, is our entire nomogram that the Excimer laser delivers to us correct? Will the Excimer laser indeed correct 1 diopter if I program him, or will he correct 1.3 or 0.7 diopters because the tissue reacts differently? To investigate this, we went back into the lab and did research work in our group and found out that indeed in a cross-linked cornea we have to adapt the entire Excimer laser nomogram and reduce and we have a reduction of 12% of effect. And this will be implemented in future versions of Excimer laser software. So the surgeon will have a checkbox to say, oh, this is a cross-linked cornea, I check mark this box, and then the entire nomogram changes. Our machine, the one I'm working on, my Excimer laser platform, has a custom-made firmware adapted already to our machine. And I will just show you one of the examples we achieved, improving useful vision from 2030 to 2020 in this case. This is of course a very nice case, but it shows you the possibilities of this wavefront-guided approach using a customized nomogram. And we are limited. We should not remove an abundant amount of tissue. So we limit ourselves to 50 microns of maximal stromal ablation, which also limits the possibilities to completely regularize the cornea. Still, the patients have tremendous advancements in the visual quality also. And that's the last message I would like to give. In these patients, we sometimes do not see a clear increase in CDVA. CDVA might be the same pre- and post-operatively, but the patient will say that his quality of vision is so much better because the aberrations have been reduced so much. Thank you. I have no financial interest to declare.